Good afternoon. I'm Fraser Ratchford with Canada Health Infoway, and I want to welcome you to this webinar on mobile health, which is part of our Imagination Challenge efforts to bring together our community of innovators. Today we're lucky to have two esteemed presenters. I'll introduce them in a second, but first I want to just go over a few things with our challenge teams. Earlier this month we announced a new but very time-limited award. In honor of the new year 2013, $2,013 will be awarded to one team in the challenge that has not previously won an award. The deadline to be eligible for this award is the end of this month, January 31st. So any potential teams that have not yet joined the challenge out there should be sure to visit the challenge website, register, join, get qualified, and you may have a chance at this award. Also, we'd like to note a congratulations to all our current teams who have been pressing the gas pedal and driving us towards the next million. As you can see on our odometer slide, we are very close to our 2 million goal. So that's 2 million uses over the course of the challenge thus far. We encourage all of you to continue to accelerate. Remember, 5,000 will go to one team when the checkered flag is waved. So we are almost there. Now, not to preempt this particular webinar, but we just want to let you know about an upcoming webinar on February the 6th. We are very proud to host Wendy Lee from Kaiser Permanente. She leads their IT, digital health, technology, and strategic initiatives, and is the Chief of Staff to the Chief Information Officer. To receive the details for this webinar, please email the, the innovation account that you see on this slide, and we'll be sure to get back to you with the details. So, without further ado, I'm happy to introduce our two presenters. Duane Bender is Professor of Software Engineering Technology at Mohawk College and leads the Mohawk eHealth Development and Innovation Center. Dennis Giokas is Infoway's Chief Technology Officer and heads Infoway's Emerging Technology Group. So over to you two to talk to us about mobile health.
Thanks, Fraser. This is Dennis Giokas. I'll kick things off. Duane is going to add some editorial comment to some of the slides, and we'll pick up a few of them as we go through this presentation. So good afternoon, good morning, depending on where you are in the country. The first thing I'd like to really chat about is this concept of Nexus of Forces, and this slide is 100% of it is material from Gartner Research. They do a lot of research in IT, and I want you to put this in context to your daily life. Don't even think about it in the context of healthcare and the things that you do every day, and I'll share with you some of the things that I do every day in that context. I'm a bit of an information junkie. That's one of the four forces that we are being influenced by and impacted by. So we are constantly either seeking out information, news, financial information, sports, maybe medical information, or we're constantly creating new information bits ourselves. Another force here is the platform that we use to do that. In mobile has become a major component of my life. I carry around 3 devices on 3 different operating systems. I have a Windows-based PC that's corporately issued, I have a BlackBerry that's corporately issued, and I have an iPad that's personal. So there you go, 3 different operating systems, 3 different form factors, and namely screen sizes and different kinds of keyboards, and I do the same work on all 3 devices. And sometimes I'm interoperating with one and have the other 2 quite nearby on the sofa or on my lap, whatever the case may be. We become very social in our work, whether it's just socializing or interacting with folks via something maybe even very low tech, SMS and email, to these social platforms like Facebook and LinkedIn and blogging and commenting on blogs and the like. And whether you realize it or not, a lot of what you do is software and hardware that sits in what people are referring to as the cloud. If you have a Gmail account or a Hotmail account, you're using the cloud with hardware and software that sits there and is providing you a set of services. So just to sum that up, information is a context for delivering very much enhanced social and mobile experiences. Mobile devices are a platform for information access and social networking. Social is linking people in new and unexpected ways, and the cloud enables, one of the things that's enabling the delivery of information and functionality to you as users, regardless of your role, regardless of your work environment. So in Gartner's words, the forces of the Nexus are intertwined to create a user-driven ecosystem of modern computing. So on the next slide, what I did was take their words and morph them to put them in a health context, and in very specifically a Canadian e-health context. Maybe a little hard to see here, but if you look at the dark blue text, those are the changes that I've made to their words, typically additions. So it's not just about information being the context, it's health information, and it's enhanced to deliver collaborative and coordinated care experiences for the clinician and the consumers of healthcare. It's not just about mobile devices. You're also using point-of-service systems with software on it, and the mobile device with some software on it that are a platform for supporting you and your new ways of doing work. And it's not just about the social aspects of these Nexus of Forces, but it's much broader in our context. It's around the health IT ecosystem, which is really all of the applications and devices that we're using that are linking us as people in unexpected ways, clinician to clinician, clinician to consumer, and consumer to consumer. And then finally, what's the cloud doing? Well, it's all of the e-health infrastructure as software as a service, and you can think of even the EHR that every province and territory is delivering. It's an information source delivered up in the cloud, if you will. Think of it as software as a service that's enabling delivery of various kinds of news services, some very basic like privacy and security, some very specific to healthcare like clinical decision support, and delivering that functionality to you, as well as clinical information and personal health information to you when you need it, as you need it, literally on any device that you need it on. So these same forces are changing the way we see and use computing in the healthcare environment. Not to be outdone, one of the leading physicians in digital health, Eric Topol, has seen the same thing. Hopefully you've seen or read his book, which is an image to the right. This particular quote is out of Wired magazine back just about a year ago now when he was interviewed. And the key words that I just covered from Gartner are here as well. The internet, which is connectivity, think of that being kind of the vehicle for that social aspect as well as a vehicle to get information. Cloud, supercomputing, all of those things are breaking medicine out of its cocoon. It's super convergence, another way of saying a nexus of forces. So, you know, Eric is seeing these same kinds of things impacting medicine, and I think we will continue to see more and more of that over the decade, and certainly in even shorter time frames. Mobile computing has really taken off in the healthcare context. You can see the stats here. I'm not going to read them to you. I had the same slide in a presentation I did a year ago, and the numbers keep increasing, and I'll show you some more evidence of that in a few slides. So, you know, the penetration of these devices among the clinical and consumer community has definitely gone up, and the percentage of use specific to healthcare has definitely gone up. Next couple of slides really are really kind of forecasting some of the use and benefits of these technologies. One is certainly in remote patient monitoring, and we'll cover that in some more detail later. But this particular table is forecasting some of the savings that could come from remote patient monitoring. And why do we bring this one in? Well, very often the device that's aggregating all of this data for the consumer is either a special purpose device that might be sitting on the end table in their living room or bedroom, or it's in many cases a smart device like a smartphone or tablet, which they already happen to own. And these devices are serving as a means to aggregate that data from these devices. Could be the glucometer, it could be the weight scale that's in the home, transmitting the weight and BMI data back to these devices, and then that's even aggregated and analyzed, and some of it selectively sent to clinicians, and certainly available to the consumer on those devices to view how they're trending on their sugars or weight or whatever they're monitoring. And then this study that was done that suggests, this is U.S. data, that the U.S. healthcare system over 25 years could save nearly $200 billion if remote monitoring was effectively used. So some pretty impressive promise. I'll qualify the word or underline that word promise. We still have to show the real benefits, and some recent studies obviously call into question if there is that real benefit, but I think we still need to pursue this agenda and prove whether there is or isn't in a more empirical fashion. And then some more data on potential efficiencies and quality improvements on supporting the elderly with these solutions, maternal care, access to folks in rural and remote regions, and just the convenience to clinicians and consumers around collecting that data. Again, some fairly impressive statistics here with respect to the efficacy of these devices and the apps that are running on them. So let's look at mobile devices and what makes them unique and different for us as consumers and what we do every day, and for clinicians. Certainly one of the things for most of us, they're always on, they're always connected. It's very rare that my device is not connected to a network. I very often will have it connected to a Wi-Fi network, primarily for performance and cost savings, but I could literally be anywhere out in the backyard playing with the kids or grandkids and still be connected. And if I'm a monitored patient, just imagine that patient's data could still get to the right person regardless of where they are, if that's one of the tethered points for those monitoring devices. For me, one of those three devices I mentioned earlier is always with me, and it's always on and it's always connected. It happens to be my smartphone of the three devices, so it's just the nature of having that device with me at all times. And the convenience of having that is huge. I could be standing in line waiting for the coffee and doing something. I could be sitting on a plane. I could be working on the train. It doesn't really matter. The convenience of having these devices and being able to get information or input information, effectively run a transaction even. I could do a banking transaction from this device. I could update a person's personal, my EMR record with this device. It makes it very, very convenient. Certainly, if you will, the information's at your fingertips, but remember where most of that's coming from. It's not on the device. These apps may support the end user to some degree, but probably 90% of the app and all of the data is running from what we call the cloud. So, the value of these devices is when they're connected. Most of the value, not all of the value. Special purpose apps are available. I have a bunch on my iPad around health and fitness, and some of those run standalone. Some of those connect me to social networks. Some connect me to back-end databases. But the number of apps that are out there, and one statistic I saw just a few months ago is there's 40,000 medical health apps available to consumers and clinicians. The good news is there's 40,000 apps. The bad news is there's 40,000 apps, because which ones are good and which ones will have a sustainable business model and will be around in even a year or 2 years from now. These devices also have the advantage of putting you in context. In other words, a geolocation. Almost all of them have a GPS receiver on them, so they can put you in some kind of context. So if I were to write an app that says, well, where's the nearest dentist, or where's the nearest walk-in clinic with the shortest wait time that can deal with a broken limb, imagine putting that into context like we do today. Where's the nearest Italian restaurant is something I've done. Where's the nearest pizza is something I've done. So you know, you can put some of your queries, if you will, in that geolocation context and make the device even that much more convenient, because the results of that query that come back are put into that context for you. I spoke already about these devices being kind of that mobile monitoring diagnostics hub and aggregator. I can't recall if I mentioned the word analysis, but again, these apps that are on these devices can do some analytics. They can, you know, graph my blood sugar over time, for example, correlate it against what I ate. If I have asthma, you know, I could input what was I doing when I had the asthma attack, what was the weather, pinpoint my geolocation and be able to get later the pollen count or something for that spot. So there's all kinds of things we can do now with these devices and some of their underlying features that we couldn't do just a few years ago. And then enhancing communications among clinicians and between clinicians and patients, because it's certainly much more effective than the old-fashioned pager, will you call me back? Certainly a lot more effective than the telephone, because I may not always have access to one, or it may not always be convenient to communicate over one. So it's just yet another channel to communicate. So let's talk about some of the motivations in 3 areas, and Duane's going to pick up on these next 4 slides.
Okay, thanks, Dennis. So like Fraser said earlier, my name is Duane Bender, and I'm the director of a center at Mohawk College in Hamilton, where we've been researching and developing e-health and m-health apps for about 6 years. And so I wanted to dive into a little bit about 2 kind of areas here today. One is we'll take it down to the next level of detail of the groups that are actually going to be adopting m-health and the main motivations of those groups. And then also then talk about the types of apps we're seeing and how they tie back to those motivations. So the first slide here is the motivation for m-health. I actually looked it up in the dictionary. I'm not really sure if this is a word or not, but I'm calling it a trichotomy in healthcare. So we're seeing both the patient, the provider, and the payer motivations, and they're actually very different on the ground. Over the last couple of years, we're seeing m-health development by each of these groups and for each of these groups as a benefit. So from the patient point of view, the patient motivation that we're seeing is typically better health, but actually in many cases, we're seeing the interest really around the better health for not necessarily the individual patient, but their loved ones in their circle of care. So the parents, the children, the cousins, people are really motivated to get involved in the care of their aging parents, in the care of a childhood disease. We're seeing a really strong motivation in that direction. Patients have a strong motivation to become empowered. Especially in Canada, we have a very high postgraduate, high school graduation rate now, post-secondary education. So people are demanding, they're more critically thinking, they're demanding more information, more empowerment. They're not okay with the previous generation of just accepting one doctor's opinion as the gospel. They're much more motivated to seek out more reliable health information from curated sources, be in better communication with their provider, track their own conditions, and get access to their records so that they can move from provider to provider with a patient-centric facility. And we're also seeing a lot of quite a desire to be socially engaged with other people who are in the same condition that they're in. So I'm going to give a couple examples of this on a future slide. But we're seeing patients driving towards social media sites specific to diseases, specific to communities of people that are in the same situation that they're in. Those are very strong motivations. From the provider point of view, the typical provider motivation that we see is better outcomes, better health outcomes. And providers are seeing this through patient data recording. So in previous generations, providers would ask people, how are you feeling today? How have you felt the last couple weeks? Very unreliable types of information. I've seen a lot of providers now that are getting quantified data, physical recordings taken, asking their patients to actually use apps to record conditions, as they progress on a daily basis, much more reliable quantification of data, and able to review that when the patient comes back. We're seeing some communications applications, direct provider to patient applications. I have a couple examples of that coming up, but there's a big demand for that type of communication. So the diagnostic assistance, a lot of physicians are using apps, mobile apps for diagnostic assistance, especially in the medication realm, where there's a lot of good information about drug interactions, or very clear recommendations from an assistance tool on what dosage or what interaction can be found in a particular instance. From a provider point of view, we're also seeing the motivation. Providers want to avoid unnecessary visits and therefore create capacity in their practices for better management of patients to achieve these better outcomes. So we're seeing the providers ask the patients to get more involved in their own care and avoid unnecessary visits, and therefore creating capacity. Now, one thing that's happened in Ontario, and I'm quite honestly not sure what's happening across the country, but recently the OHIP billing schedule in Ontario has been changed so that physicians at the provider level can actually bill for some electronic interactions. And this is actually a groundbreaking shift in the way physicians typically are not, previously were not able to charge even for telephone calls with the patients. Those were not prohibited, not allowed according to the previous OHIP schedule. So the fact that they're acknowledging these electronic interactions, and there's actually some fee billing schedules, codes available now and more coming, is a ground shift, and will enable a lot of these things to continue on. Now, the third part of the trichotomy is the payer. In Canada, the payer is primarily OHIP. I'm not sure what the number is in Ontario. I would estimate it's probably about 70% that OHIP covers, and about 30% is the private insurance that is covered. But on the grand scale, the payer motivation, the primary motivation of the payer is to reduce the risk of the population and therefore do cost avoidance through having better health in the population. So if they're able to use, so you're seeing some, again, I'll provide some examples in a future slide, but we're seeing the payer's motivation targeted towards increased population of or increased health of their entire population. Now in the US, if you look at what they're doing down there's a lot of insurance company involvement in mobile health and population health. And one of the things that's interesting there is that there's a cost avoidance model through retaining customers in network between these competing networks of healthcare providers. Now we don't see really an analogy in Canada. So far I haven't seen that, but so it's very similar to almost like a mobile phone subscription, where once you subscribe to an insurance plan and you're in a network, they try and retain you because it's a current customer is better than losing a customer and trying to regain another customer to replace them. Very expensive. So customer retention and churn is an issue in the US, not so much in Canada. Once you have a large population wired up with these mobile devices and cloud computing that Dennis was talking about, you can gain a tremendous amount of visibility into what your population is doing and provide a direct communication channel to them, and then provide analytics and reporting on their behaviors and their patterns, and therefore potentially change the way they behave en masse, and therefore lead to better health outcomes and more cost avoidance. So I'm going to switch back to Dennis for a couple of slides, and then I'll give some examples of those motivations and what we're seeing in the market.
Thanks, Duane. So we heard a little bit of the promise or forecast promise. Maybe we can talk a bit about some of the challenges, because using these devices and the apps on them are not without their challenges. You know, when you're dealing with information, one of the big challenges in it is interoperability. Can I exchange or share information, and do I understand the information that was exchanged in that context? And it's no different with a mobile device. In fact, we are making this issue even more challenging for us because we've got more points of connection and more need for what's referred to in the industry as semantic interoperability. Especially in a clinical context where I do not want to misidentify the individual for whom this data is associated with, nor misinterpret the information, whether it's by a human being or in a software algorithm. These devices, by their very nature, are under the control of the individual, whether it's corporately issued or bring your own device to work kind of context. Users are provisioning these devices with their own apps and on their own terms. Some of that's controlled by management mechanisms that can be put in place by an organization such as a hospital or a health region or a private employer. But in some cases that's not been done or is not as rigorous as we would like, and you just have to deal with the issues associated with that and the potential risks that are associated with provisioning these devices with your own apps, which relates to the second point around monitoring and managing these devices. You know, everything from can I wipe the device when it's stolen, and can I ensure that there is no personal health information on the device, that it's only cached in memory for a very short time and certainly wiped when the application terminates. Related to privacy and security, you know, can I deal in a privacy sensitive manner with this information and know that even the transmissions of that information over the wire are secure. The supporting policies, whether you're a clinician, from a legal regulatory frameworks perspective, what does the Medical Protective Association say? What does the college say? What does your association say in this context? All of these are factors that need to be thought through and dealt with in that context, which then leads to challenges around change management. Everything from new processes. I may be dealing with a client or patient literally 24/7 in some cases, new care relationships in that context, and maybe even changes to job responsibilities and even scope of practice in that context, which then leads to incentives. What is my incentive, back to Duane's slides, for wanting to use these devices and these applications in these various environments? Or is there an alignment of incentives, whether I'm the payer, the provider, or the patient, and is it win-win in that context? Regulation is something we have to be conscious of. We've seen cases of innovative applications that can't be released fully because of either regularization or licensing requirements. In the case of Canada, there are some requirements when you connect a medical device to any piece of software. Needs a Health Canada device license. So, those issues have to be clarified and maybe adjusted in the future for these devices to really reach the market penetration and the benefits that we think they could. And then related to my earlier comment about there's good news is there's 40,000 apps, the bad news is there's 30,000 apps. How do you know which ones have been curated, which ones have clinical efficacy, which ones have been certified to be of higher quality with respect to interoperability, privacy, security, even functionality, such that you, regardless of your role, consumer, clinician, health administrator, whatever, can feel confident that these applications and devices are serving you well. And just to put it in perspective, here's an interesting graphic on the number of downloads. The number of people who have downloaded a health app has doubled between 2011 and 2012. So one of the things I want to do is if you haven't heard it through events like the eHealth conference or partnership, Infoway over the last, I think it's been actually almost a year and a half now, if not longer, worked on a strategy through 2018. So what would be the country's priorities for more digital health over the next 5 years? And the 5 themes emerged, which I will show you in a second, with an overarching theme around enhancing the patient experience. And what I'm going to do is very quickly show you the 5 themes, and we're going to drill down into each one. I think there's a 1 or 2 sentence description of it, and then put it in this mobile health context. What could mobile health do in the context of those 5 themes to support enabling them over the next 5 years. And these are not meant to be the only things that would enable them, but the subject of this webinar certainly is mobile health. So the first is bringing care close to the home. These are in no particular order, by the way. The second is provide easier access. The third is support new models of care. The fourth is improve patient safety. And the fifth is enable a high-performing healthcare system. So moving right along, the first is bringing care closer to home. One of the areas of opportunity here is using mobile patient monitoring solutions and other consumer health solutions to hopefully leave people in their home or closer to home in that context. So, for example, monitoring chronic disease, monitoring their health conditions, maybe even monitoring their wellness, so they don't need health care in the future. So we're seeing a lot of devices being produced and approved by various organizations like Health Canada, the FDA, and at very, very attractive price points and consumer usable. You see some pictures down at the bottom, on the bottom right-hand corner of some of those devices that can be used in the home. Some of them very sophisticated, some of them very simple. What can these devices do? Well, one thing I mentioned earlier is they can be that aggregation point. So the glucometer may show the reading on the screen, but it only holds maybe the last reading or the last few readings. And I want to interact with that information in other ways. When I took my blood sugar, what was I doing? What did I eat recently? Can I graph that over time? Can I correlate it against what I was doing, such as physical exercise, or what I was eating or when I ate? That kind of thing could all be better done on these other platforms, such as a smartphone or a tablet in that context. And certainly those devices can hold a lot more information. Virtually all of them have cameras or video capabilities, so it could be the tool that I use to get that clinical consult, whether it be through email or social context or through video link or audio link in the context of those devices. Since I have the device with me, it's always on, I'm always connected. It's a great place to send an automated alert and reminder. Could even be a loved one reminding an elderly parent to take their medication, and that reminder is queued up to go off at a certain time, and because they have the device, that alert is easily accessible to them. They don't have to be near a computer, for example. And then I can use these for health management, wellness, and even education, surfing the web. So let's talk about health management. A lot of these apps can do journaling, for example. I can use them to record. I can use them to incent me in the context of managing my own health or wellness. So, these apps have a lot of very interesting functionality that can aid the consumer. The second theme is provide easier access. So think about this being a more convenient healthcare experience, in other words, interacting with the health system. So some examples of that might be just communications. I need to communicate between from provider to provider, or between provider and the consumer. And this channel, if you will, whether it's email or SMS or even a video link from these devices, becomes that communication channel. Schedule when it's convenient through the device versus going to a PC. Request an e-visit, in other words, an e-prescription renewal from these kind of devices, just like I check into Air Canada the other day from my device versus it doing it from my PC. Imagine checking in with my clinician for that e-prescription renewal in that context. Finding things, like I mentioned earlier, around finding the clinic in the context of where I am and what I need for a service. So that capability is offered up to maybe all the citizens of a province, and there's some algorithms that run in the back end that use this information that I'm inputting, what kind of service do I need and where am I, and then tells me where the nearest clinic is, or where the nearest clinic is with the shortest wait time, if you will. Journaling, another example of where I can capture information as it is happening. Maybe a mental health app and I'm feeling depressed. Well, what triggered that? I'm getting an asthma attack, what might have triggered that? So I can use that to record information, if you will, in real time, and then one we mentioned earlier, alerts and reminders is another aspect in this context. Supporting new models of care, some of those opportunities are that person-centered care, dealing with better continuity of care and navigation of the healthcare system, and even chronic disease management. So from a clinician perspective, this becomes another tool for communication and collaboration. Even some social networks are springing up among clinicians and clinician specialists for sharing information or getting advice from their peers. One of my favorite tools is, not to promote any vendor, is what's from a vendor called Airstrip, that allows me to monitor from a distance. So cardiology and fetal monitors that stream their data from the device, tethered to the patient obviously, to the clinician's smartphone or tablet in real time. So they could literally be anywhere monitoring it versus looking at a paper strip. And so it's a very innovative use of the device to make clinicians more effective in that kind of context where they're not at the patient's bedside. And then from a patient's perspective, use these apps to modify behavior and modify or support compliance. So some of this is actually using gaming technology. When you think about games, a lot of gaming is foundationally is based on a reward system. You know, pick up the bag of money, for example, or get to the finish line first. We'll use some of those same strategies that are used in gaming to incent the right behaviors. And I know Duane has the example of one of those later that we can talk about. And then promote and enable patient self-management. You know, whether it's health and wellness and fitness or support of a chronic disease. Improve patient safety. One of the things that we highlighted in our strategy is reducing or eliminating preventable medical errors and adverse outcomes, particularly around medications. So these devices could certainly be used at the bedside in that context, used for ordering, used for drug utilization review. And let's say I barcoded all the patients and the medications, even put in a barcode reader, or actually the camera on them allows for that, but the software to support that, to support administration of those medications in that context. So it's just another tool that could be used for closed loop medication reconciliation and administration. Again, these are very much real-time devices, very context-rich, and can be used for communications among clinicians, you know, whether it be a shift change among the nurses, whether it be nurse-physician communication, any of those kinds of things where I need access to content and communication in somewhat real time. And then, as I mentioned earlier in an earlier slide, that the remote tracking of real-time feeds, such as the cardiac and fetal monitors, where I could literally be anywhere. And then finally, enable a high-performing healthcare system. The foundation of this are things like clinical decision support and analytical solutions around, could be administrative information, could be clinical analytics, could be population health analytics, any of those things. But now the guidelines or the key performance indicators, the dashboard, you see an image of one at the bottom of the screen, are available all the time, updated in real time on these devices, so I constantly know how I'm doing or how things are going. If I'm let's say that I'm the hospital administrator and I want to know about some of the key performance indicators for my health delivery organization. So those are the kind of the 5 themes in how mHealth or mobile devices and software might be used in that context. I'm going to turn it over to Duane to talk about some real-world examples in the 3 areas that he highlighted earlier: patients, providers, and payers.
Okay. So, so if we think back about the 3 big groups, the patients, providers, and payers. So this is from the patient perspective. These are some of the new, relatively new services that we're seeing here live in Canada right now that are in the marketplace, and I just wanted to kind of highlight a few of them and show, you know, or kind of fit them into the classification system here. So one of the things we're seeing here, I'll start with actually the top right, the M-Cards service. M-Cards is a FDA certified, Health Canada approved cardiac loop monitor that's paired with a BlackBerry smartphone that patients can actually be prescribed today in Ontario if they show signs of heart trouble. Their doctor can refer them to this service. The service actually drop ships the device to the patient, and the patient self-administers the loop monitor and turns on the phone and kind of wires it all to themselves on their own, and then they automatically activates them inside the service. So once the referral is done, the physician is no longer directly involved in the service, but the patient is actually empowered to take control over that, and that will record their heart activity on roughly 2 week cycles, and report back to the doctor eventually, the provider eventually, directly through the internet. Another one here is WellX. WellX is a system. It's a communications platform for providers to talk to their patients in a secure fashion. It's been reviewed by the Privacy Commissioner of Ontario, and there's approved by them, and they follow all of the Ontario and federal, provincial and federal guidelines for security of health information. We have about 40 physicians live today in Ontario that are using that. I'm not sure how many patients, but that's an example of a system there that's working well. And we're also seeing from kind of the EMR, the traditional EMR space, the EMRs have, a lot of them are branching out with the personal health record extensions, the PHR extensions. So the two that I'm most familiar with are the MyHealth system and the MyOscar system, which is an extension of the MyOscar EMR, which also allows patient-provider communications and actually sharing of selected lab results, diagnostic imaging results, and so on, to include the patient, give the patient direct access to their own medical records and reports. Another one would be Pocket Labs. In the top left-hand corner, there's a photo there. These are one of the winners of the Hacking Health competition that was held at Mars Discovery District here in Toronto a couple months ago. The application was called Pocket Labs, which was a patient view into the jurisdictional lab results. So the lab results that come through, so when you go to your provider, they draw blood, they send the blood away for analysis. That analysis, typically you have to go back to your provider and sit with them, take another half a day just to find out everything's okay. Pocket Labs gives you direct access to those lab results, also wrapped in curated medical information about how to interpret the results for a layperson. It's the first instance of that I've seen. Patients Like Me is a little bit different. It's a social media campaign. Patients Like Me in the U.S., in fact, was started by a brother that had a serious medical condition, and started a social media campaign to find out as much as he could about it and find other people like them. And since then, it's expanded quite a lot. Covers many diseases now. There's many hundreds of thousands, if not millions, of people participating. And recently, I heard that Patients Like Me has now been approved by the FDA to conduct clinical trials through the patient population directly, and without the involvement of a pharmaceutical company directly. So very significant shift in how clinical trials are handled there through the power of social media. SmartMed is a smartphone application that is a medication reminders program. I'm self administering here though, because it came out of Mohawk College and McMaster University's work. SmartMed won the National eHealth Apps Challenge last year at the Health Conference, but it's a cloud-based medical reminders and medication adherence solution. And the bottom, I didn't mention the name, but in the bottom left-hand corner, this is an application that's currently under review by the FDA in the United States, that was developed by a Canadian company, that is a board-certified hearing test for the prescription of hearing aids in the United States without the use of an audiologist. So the patient can actually self-diagnose their hearing level and self-prescribe their hearing aid. It's a brand new approach that they're trying in the United States. So a little bit, now there is some overlap here, but I'm gonna put these in the context of the providers because these could also be considered to some degree patient helpers, but there's provider helpers here. Epocrates is a very, very popular, if you talk to any providers that use mobile health or use their iPhone at work, almost every doctor that I encounter now has Epocrates on their phone. Epocrates is a drug reference and a drug interaction checker. In the center there, we have this thing called iCatra. It's been in the news quite a lot. It's a very, very cheap disposable lens that can detect cataracts using a smartphone, and they're using this a lot in the third world countries where cataracts are actually the #1 cause of blindness in third world countries. But with a simple check with a very inexpensive device, we can diagnose and repair cataracts very quickly and save a lot of eyesight globally. Now BANT is a very popular, is a diabetes management system for youth, for preteens. And you can consider it probably a benefit to the patient as well, because BANT allows you to track your diabetes through glucose readings. Also has social media connections to other children with diabetes, and has a gamification reward system for young people to reward them for tracking their diabetes and checking in their blood sugar. And it's won a few awards that came out of the University Health Network here in Toronto. But the interesting thing from a provider point of view is that the providers get a feed of all that quantified data about exactly how the patient is doing, and know when to interject before the patient has a serious episode from their diabetes becoming mismanaged. So look at it from the provider point of view. Down in the right-hand corner, this is a product that came out of Mount Sinai Hospital here in Toronto. This is it's called the Vital Hub, which is a new approach to the patient record in hospital. They started out in hospital, so it has much more of a has very mobile-friendly, very responsive user experience design there, and has been very well received by clinicians. You see also the Ottawa Hospital has their own something very, very similar to that. But we're seeing providers using those apps quite a lot now. I'd say more are using tablets to access hospital interfaces than anything else that I'm interacting with right now. And one thing that just another device that was just recently approved in the U.S. By the FDA is this AliveCore device in the bottom center, which is actually an ECG jacket for your iPhone. So a cardiologist, presumably, or maybe even a general practitioner could suit their smartphone with the ECG device and be able to take a heart rhythm in real time. And the final category here, the payer. So some examples of the activity we're seeing in the payer category. This application, iTriage, was one of the most downloaded mobile health applications in the iStore, the Apple App Store, in the last couple of years. It was recently acquired by an insurance company in the United States called Aetna, as a way to provide analytics about the community of care underneath Aetna, but also to provide in-app referrals, provide waiting times, and look at other health-related information. In Ontario, we have the group that's responsible for probably going to be a big part of the wireless home monitoring network is the OTN. And OTN, I know, has a lot of projects underway, again, to try and help people stay home with their illness and deal with things outside of hospitals. More often than not, I know they have another number of initiatives underway to help people live more comfortably with their conditions at home. One of the interesting things, again, related back to the Pocket Labs application, eHealth Ontario recently is doing a pilot right now project to offer a platform for any provider to connect to the OLIS lab results repository, and to be able to provide any patient to be able to get their lab results directly from OLIS through a provincial platform, which I think is really exciting. That's a very big shift, again, that they're taking there. One of the big devices that is recently creating a lot of excitement in the United States is the Qualcomm 2Net platform. The 2Net platform is a device aggregator. So Dennis showed a slide earlier of a bunch of home consumer devices that collect data. The 2Net platform actually relays that data through the cell network or through Wi-Fi networks back to a monitoring system, and actually aggregates that data into health records and manages and routes that data, provides notifications, thresholds, things like that. Applications are built on top of the platform to enable this whole ecosystem of the home monitoring to happen. So I think you should. Qualcomm just recently in December announced that they're coming into Canada this year. I think that's something to watch. And another example of patient access to lab results there in the bottom right-hand corner out in BC, and this has been going on for a few years. They have a service called My eHealth, which has been providing BC access to results. I talked to these people a couple months ago, and I had the same concern. Everyone in Ontario had the same concern. Well, what happens when we release these results to people? Are they going to go crazy and ring the phones 24 hours a day? And the experience in BC has been that they've just laid off their 24-hour people that were on call 24 hours a day because they just didn't have any volume of calls. People were just checking the results, looking things up, and then making appointments with their providers at convenient times.
Let's just get to some conclusions, and both Duane and I will each have a provocative slide that maybe will generate some questions as well. So just some key conclusions. Focus on the solutions, not the device or the platform. The device is important. The form factor of it's important, but the solution, in other words, the app on the device, and probably maybe more importantly, the app behind the device is even more important because it holds the information and other algorithms that need to run. And certainly it's already a prominent device for consumers and clinicians, so we need to embrace it rather than not, in our opinion. Certainly choose the platform that's most fit for purpose. You can't just give every clinician a smartphone or a tablet and call it done, nor can you give every consumer a smartphone and tablet and just call it done. So consider that in your context. Most of you will be multi-device, multi-platform. Be aware of privacy and security considerations. These devices we believe do have tremendous potential. We highlighted some of that earlier, but sustainable solutions are still emerging, so we have to be cautious about which ones we tie ourselves to. We still need more clinical evidence of efficacy. We need to make sure the payments and incentives are aligned, and organizations like the FDA and Health Canada still have to make rulings on regulation. So just to be a bit provocative, this is actually a blog post by health strategist Leonard Kish. The title of his blog, The Blockbuster Drug of the Century, An Engaged Patient. I'll let you read the quote, but I'll just say, can we say that mobile technologies and apps are the drug of choice in that context as a way of engaging patients along the lines that we showed you earlier? And then finally turned over to Duane.
So this is something we talk about quite often in my labs. Is this a possible future that we're going to have prescribed apps and devices as treatments and courses of care, so that essentially you would have an apps pharmacy instead of an app store? And are we going to see in the next couple of years doctors adopting that philosophy of take these apps and these devices and then let's collect some data and call me in a week and let's see how you're doing?
So thank you very much. I guess we'll open it up to any questions again, Fraser?
Yes, exactly. We have had one question over the webinar, and just a question about, are there any leading jurisdictions, particularly those that are publicly funded, that are implementing meaningful programs to encourage behavior change? Are either of you two aware of jurisdictions that might be kind of leading the charge and incenting more mobile behavior? And
I see it in pockets. You see these innovations, like we actually are funding one, as you know, Fraser, around mental health here in Ontario. We see organizations like certain hospitals that are very much forward-looking with respect to using these devices for communications among clinicians, using these as physician or clinician portals into a clinical data record that might be in that organization, such as the Ottawa Hospital. Of course, BC with making lab test results. I think they were the first to make them available to consumers that I'm aware of on a broad basis. And that wasn't even the province, that was Accelerus, which is a private lab results distribution service for the private labs in BC. That's the good news. The bad news is it's just for the private labs. So, you know, how does a citizen get all of their lab test results? And of course the clinicians get them all as well. So I think we're seeing it in pockets. I hate to label anyone as the leader.
We have a question.
Oh, hi. No, it's Dennis. It's Sophia Bouvier from the Western team at Infoway. And I just also wanted to remind you about the Alberta Personal Health Portal and how they've bought, they're basically implementing the Personal Health Portal for the province. And they will be implementing a mobile solution for that Personal Health Portal as well.
Thank you, Sophia. You're absolutely right.
So I haven't seen particular jurisdictions, but I've seen organizations that have taken leadership roles. There was a lot of activity last couple of years around smoking cessation, so there's a lot of leadership being provided by the Ontario Lung Association, Canadian Lung Association, in reaching out to researchers and using gamification strategies to try and change behavior they were targeting specifically smokers in that case. So I haven't seen it. I can't say there's a clear winner in jurisdictions, but I think there's, again, pockets of excellence in different organizations.
Hi, it's Mary Russell from Nova Scotia. I was wondering in particular about releasing lab results to patients, and have you had any concerns from, or heard of any concerns in any jurisdictions that are doing this?
It's Fraser speaking from the program point of view here at Infoway. There has been some concerns, but if we look to an example like Sunnybrook, for instance, who've had patient access to their entire chart and lab results, when they initially designed the system, according to their CIO, they did design the system so that every service could decide if there needed to be some sort of delay or some sort of precaution in releasing results. And at the time of go live, 2 of their services actually decided that they wanted to put some sort of restriction on actually having those results available in real time to the patient. Since then, every service, now every result, is available in real time, and they're finding that it's patients are liking that better, and clinicians have adapted in that they're making sure that they're doing that education about what different results can mean before they actually receive the test, so that then when they go online, they can look at the result, they're prepared for a discussion when they actually come in for their clinical visit.
I see, because we're moving ahead with a patient portal that will give access to patients for their lab results, and we're currently discussing whether we use sort of an auto-release function or not. I mean, so we're discussing with specialists and with services what might be the best route, because a pathology report, for instance, that says I have cancer, would that cause a negative reaction in a patient to see it prior to having a conversation with the physician? And that's the concern that's being raised.
Yeah, there is some good peer-reviewed literature on that topic. I know, support what Fraser said, most organizations have loosened that requirement and made them all available, and maybe with few exceptions like a lab-confirmed STD that you might have a 3-day embargo. Which also incents the physician to be timely in their review and communication back to the patient, which is what patients expect from the health system.
Yes, that would be great. You said peer-reviewed literature. Any way I could get access to some of the
Well, I would just do a literature search on that general topic. I don't have the titles offhand.
Certainly, if we can get our hands on it, we'll communicate that to you directly.
Okay, that's great. Thanks very much.
You're welcome. We've just hit the 2 o'clock mark. I'll take one more question if there's one coming.
Yes, I have one of Stephanie Beaumont from Lawson Health Research Institute. And we touched on this very briefly, and it's around the regulatory with Health Canada health licenses. And it's kind of confusing when you read the outlines on how you pursue these. So my question is, how does one define when an mHealth solution must be licensed?
Yeah, if you're tethered to a medical device, you have to be licensed. That's the simple answer. So Duane highlighted band. It's a iPhone application, but if it's Bluetooth to the glucometer, it needs a medical device license.
Okay.
So the best, you can certainly go directly to Health Canada and ask, or speak to ITAC, because they have some written guidance on this and may know after you describe your application whether you need one or not, or at least a high likelihood whether you need one. The ultimate decision would be Health Canada's.
Perfect. Oh, thank you very much.
Well, and boy, time has flown by. So good thing we didn't stop for those questions in the middle. I want to thank you both, Duane and Dennis, for a really enlightening presentation, and this really, I think, helps people focus on what the possibilities are with mobile health. I think it is part of that new frontier, and for all of us to sort of put our heads around it, this has certainly been very helpful. So thank you to all of you who have also participated in this webinar. We will be sending a short evaluation after the finish. If you please take the time to complete it, it helps us plan for future webinars. And as of that, have a good rest of the day for all of you, and thank you for joining us.